You've gained weight without changing your diet. Your skin is breaking out. Your periods are all over the place. And every time you ask what's wrong, they tell you, it's just hormones. But what if it's something deeper, something called PCOS? In today's video, we're diving deep into polycystic ovary syndrome, a condition that affects 1 in 10 women globally, yet many go years without a diagnosis. We'll break down the symptoms, causes, treatment options, and even the latest breakthroughs in PCOS research that are offering new hope for millions. Polycystic ovary syndrome, PCOS, is a hormonal disorder that affects people with ovaries, often during their reproductive years. It's named for the multiple small cysts that can develop on the ovaries, though not everyone with PCOS has them. PCOS is not just a reproductive issue. It's a metabolic and endocrine disorder with long-term health consequences, including infertility, insulin resistance, type 2 diabetes, cardiovascular disease, mental health challenges, and yet, many women go undiagnosed or misdiagnosed for years. The symptoms of PCOS vary widely, but here are the most common. 1. Irregular or missed periods, one of the hallmark signs due to lack of ovulation and ovulation. 2. Excess androgens, male hormones. Acne, especially jawline/chin, oily skin, excess facial or body hair, hirsutism, scalp hair thinning or male pattern baldness. 3. Weight gain or difficulty losing weight, especially around the abdomen, linked to insulin resistance. 4. Polycystic ovaries, seen on ultrasound as enlarged ovaries with many tiny follicles. Not all patients have this. 5. Fertility issues. Difficulty conceiving due to irregular ovulation. 6. Mood changes, depression, anxiety, and low self-esteem are common. 7. Skin changes, dark patches, acanthosis nigricans, on neck, armpits, or groin. The exact cause of PCOS is still unclear, but researchers believe it's a combination of genetics, hormonal imbalance, and environmental triggers. 1. Insulin resistance. Up to 70% of women with PCOS have some degree of insulin resistance, leads to excess insulin, triggers ovaries to produce more androgens. 2. High androgen levels disrupt ovulation, cause many of the external symptoms. 3. Chronic low-grade inflammation can stimulate polycystic ovarian tissue and androgen production. 4. Genetics. PCOS tends to run in families. You may be more likely to develop it if your mother or sister has it. There's no cure for PCOS, but treatments can manage the symptoms effectively. 1. Hormonal birth control pills, patch, or IUD, regulates menstrual cycle, reduces androgen levels, clears acne, and reduces excess hair. 2. Metformin, originally for type 2 diabetes, improves insulin sensitivity, helps regulate cycles, and aids weight loss. 3. Antiandrogens, e.g., spironolactone, block testosterone, reduce acne and hirsutism. 4. Clomiphene or letrozole, for fertility, stimulate ovulation in women trying to conceive. 5. Inositol supplements, Mio and D-Chiro, nutritional compounds that act like insulin, gaining popularity as a natural insulin sensitizer. Medication choices depend on whether the goal is symptom control, fertility, or long-term metabolic health. 1. Diet, no one-size-fits-all, but low GI, anti-inflammatory diets work best. Focus on whole grains, vegetables, lean proteins, avoid refined carbs and sugar, add omega-3s, flaxseed, salmon. 2. Exercise, improves insulin sensitivity and hormone regulation, combines strength training, moderate cardio, yoga, especially for stress reduction. 3. Stress reduction, stress worsens hormonal imbalance. Try meditation, deep breathing, journaling, therapy. 4. Sleep, poor sleep increases cortisol and insulin resistance, aim for 7 to 8 hours per night. With consistent sleep, wake times. 5. Natural supplements. Inositol, myo-inositol plus D-chiro-inositol, spearmint tea, naturally lowers androgens, vitamin D, often low in women with PCOS, magnesium, zinc, and chromium. Always check with a healthcare provider before starting any supplements. Recent discoveries are changing the way we think about PCOS. 1. Gut microbiome and PCOS. New studies show gut dysbiosis plays a role in inflammation, insulin resistance, and androgen production. Future treatments may involve targeted probiotics. 2. Genetic markers, genome-wide studies are identifying genes linked to PCOS, paving the way for personalized treatments. 3. Inositol combinations. Studies show that specific ratios of myo-inositol to D-inositol, usually 40 to 1, are more effective in restoring ovulation and lowering testosterone 4. Mental health integration. New care models emphasize treating PCOS alongside depression and anxiety. Holistic models are being used in major hospitals for mind-body balance. 5. Early diagnosis models. AI tools using ultrasound, menstrual data, and hormone levels can predict PCOS earlier. Even in teens, PCOS can feel overwhelming, especially when you're misdiagnosed, dismissed, or told to just lose weight. But here's the truth. PCOS is real. It's manageable. And you are not alone. Whether you're dealing with irregular periods, infertility, skin issues, or emotional struggles, there is help. There is hope. The key is getting informed, getting support, and finding a treatment plan that works for your unique body. If this video helped you understand PCOS better, please like, subscribe, and share this with someone who might need it. Drop your story in the comments, because your experience might empower someone else to finally seek answers.